Today, let's discuss cataracts. First, everybody you know over the age of 50 has a cataract. A cataract is not a disease, it is a normal part of aging. Very much like our hair changes color and our skin loses its elasticity, the lens of the eye will gradually go from being clear at birth to brown when we're 80 and black when we're 100. And somewhere in the middle, you're not going to like your vision. Cataract surgery becomes an option when you want to see better. Now, in the healthy eye, this is the cornea and this is the lens, and together they focus light onto the retina. The lens will gradually thicken, darken, and then become more and more opacified. When it first starts to thicken, that's when we start wearing reading glasses. So the first sign of cataract formation, unfortunately, is mid-40s when people start to get the need for reading glasses. Some people call that dysfunctional lens syndrome grade 1. Now, as we age, it gradually worsens, and you may determine at some point that you would like to see better. The lens of the eye is about the size of an M&M, and when we do cataract surgery, we make a little tiny incision, we open the M&M, we suction out the cataract and put an artificial lens in its place. And when we're done, in about 10 minutes' time, the new lens is sitting in the original sac. That's basic cataract surgery. Now, we have some significant improvements in cataract surgery. That includes the use of lasers in cataract surgery and laser-assisted cataract surgery. We use the laser to open the lens and break the cataract up into small particles. We then leave the laser room and come into the surgical suite where we remove the cataract and put in an artificial lens. At the time of implantation of lenses, we have a variety of different options as well. In basic cataract surgery, we usually use either a distance lens or a reading lens, but one that only does one thing. In the middle level, where we use just the laser, we can also use something called an extended depth of focus lens. And that extended depth of focus lens will give you distance vision and a little bit of reading. And when we do the most advanced cataract surgical procedure, we are able to use a multifocal lens, which allows you to see in the distance, at computer distance, and even fine print, all without glasses. So cataract surgery has become a very, very common thing. And when I first started doing surgery many years ago, the average age of people having surgery was between 80 and 85, and now the average age is under 65.